Hi, my name's Amy Thomas and it's the 5th of May 2013. In this video I'll be demonstrating how to palpate a radial pulse, measure respiratory rate, palpate and auscultate a blood pressure, a posterior auscultation of the chest, as well as a full Glasgow Coma reading scale. I'll be using many verbal and non-verbal communication techniques. Thanks for watching. Ambulance service, may I come in?
Yeah, come in.
So gloves and goggles, standard precautions. Hi, my name's Amy and this is my partner Steph. What's your name?
Mrs. Jones.
Mrs. Jones. Hi, Mrs. Jones. Is it alright if I just sit next to you?
Yeah, take a seat.
Yeah? Cool. So what seems to be the problem today?
I've just got some tightness across my chest.
Yeah, so just
quite
a hanger.
painful.
Yeah? No worries. So have you had this before?
No, never.
No, that's okay. So we might just take a few simple tests just to see if we can see what's going on. Is that okay, Mrs. Jones?
Oh, are they going to hurt? Or?
No, they won't hurt, okay? Alright, so if you're just able to bring your arm up, we'll just take your pulse first. We'll just pop the pillow under here. So just relax your arm, that's it, good. So to take Mrs. Jones's pulse, I'll use my index and middle finger and find her radial artery. I'll then count her pulse for 30 seconds and then multiply this by 2. However, if her pulse is over 16 or irregular, I'd count for the full 60 seconds. After I've counted Mrs. Jones's pulse for 30 seconds, I'll then watch Mrs. Jones's chest for the rise and fall for her respiratory rate. Good, Mrs. Jones, okay, so that all seems normal. So my non-verbal techniques included a handshake at the start, maintaining eye level with Mrs. Jones. I also gave her a pat of reassurance when she was afraid, and I nodded in agreement. Good, so Mrs. Jones, we're just now going to take your blood pressure, okay? Have you had your blood pressure taken before?
Yeah.
Yeah? Yeah, good. Do you remember what your blood pressure was?
No.
No? That's right. Yep, so just have your arm that way. Good, and nice and relaxed. Are we just able to take your arm out of this dressing gown? Is that okay? Or are we able to pull it up? Yeah? No worries. So I'm just going to pop this cuff around your arm. That's it. That's it. Good. So again, I'm just going to find Mrs. Jones's pulse again, the same as before. Good, and then I'm going to feel for her pulse, and once I've found it, I'm going to start pumping up the cuff until I can't feel Mrs. Jones's pulse anymore. Good, and then I'm slowly going to release the cuff, feeling for when Mrs. Jones's pulse, I can feel it again. Good, and then when I can start feeling Mrs. Jones's pulse, that's the systolic number. Good. Is that not too bad, Mrs. Jones? Is that okay?
Yeah, that's alright, it's a bit tight.
A little bit tight? That's okay. So we've just got one more to do. So I'm also going to auscultate Mrs. Jones's blood pressure. So what I'm going to do, Mrs. Jones, I'm just going to have a listen this time rather than feeling, alright? So I'm just going to stick this up in here. So again, I'm going to pump the cuff up again to where I felt her systolic blood pressure. And then I'm slowly going to release the cuff until I can hear a slight tapping noise, and this is the systolic number. And then I'm going to continue to listen until I cannot hear this noise anymore, which will give me Mrs. Jones's diastolic. Good, Mrs. Jones, okay? So we'll take this off now.
Was everything okay?
Yeah, that was fine. So that wasn't too bad. So pull this back down, it's a bit cold. Good. So my non-verbal techniques with Mrs. Jones during blood pressure was showing the technique of the arm, maintaining eye contact, helping Mrs. Jones with her clothing, and nodding of reassurance. So now I'm just going to have a listen to your chest, Mrs. Jones. Is that okay?
Yeah.
Yeah? So now I'm just going to do a chest auscultation on Mrs. Jones. I will be listening through the clothing, but normally it will be done on skin. Okay? So you're just able to turn around from Mrs. Jones. That's it. Good, and then I just want you to have your hands like this on your legs. Good, and just leaning forward. Good, and can you just do a big nice cough for me? Good, just to clear anything that might be stuck in the airways. So now I'll be listening to Mrs. Jones's chest through 10 sites, starting at the APIS and then going to the midline and then to the base. I'll be listening at 2 breaths per spot, and also I'm listening for any crackling, wheezing or gurgling at any of these sites. Good, Mrs. Jones. So that's all fine. So now you can just sit back up, that's it, and turn around. So the non-verbal techniques I used with Mrs. Jones was an open tone, engaging in eye contact, helping Mrs. Jones move, and also showing her the position that she needed to be in. Alright, Mrs. Jones, so I've just got one more test to do, okay? So I'm going to be doing Mrs. Jones's Glasgow Coma score. Alright, so throughout all of the tasks, Mrs. Jones's eyes were spontaneously moving, so giving her a score of 4. Alright, so mode of movement. Are you just able to bring your hands up for me, Mrs. Jones? That's it. Are you just able to squeeze my hands? Good. So Mrs. Jones had equal squeezing on both hands and was able to respond to command when asked, so giving her a score of 6. And now I just have some simple questions for you, Mrs. Jones. Do you know your full name?
Emma Louise Jones.
Good. And do you know the year?
2013.
And the month?
May.
Yeah, good. And do you just know where you are at the moment?
Just at home.
Good, okay. Good, so Mrs. Jones was able to respond to all of those answers correctly, so giving her a score of 5, which is a total of 15, which is a normal conscious patient. Good, Mrs. Jones, how are you feeling now?
Much better, thank you.
Good. So my non-verbal techniques during this was maintaining eye contact with Mrs. Jones, having an open body language and an open tone, as well as maintaining at the same level as Mrs. Jones.